Fredericton Chamber of Commerce, and we're delighted to have everybody joining us today. Today's webinar is Navigating COVID-19, What Safe Business Operations Look Like and How to Get There. And we're so pleased to have Dallas Mercer join us. She's an expert in such things as safe businesses, having a long background in disability management services, an employer advocate with workers' compensation claims and those sorts of things. And she began her business in 2002, Dallas Mercer Consulting. Dallas has done a number of workshops for us in the past, and we always appreciate her expertise being shared with our members. So Dallas, we really appreciate you being with us today, you and Samantha and others from your team. And well, without any further ado, I'm going to let you take the mic and start the presentation.
Thanks, Krista. It's a pleasure to be with you guys today. I guess it's a couple of months today that we've been involved with all of this. It seems like a lifetime. Yeah, I guess when this first happened, we all were a little bit in a daze about what we should be doing, but our clients quickly started to turn to us for help. And so we had some discussions internally because we have an occupational health and safety team. We have occupational health nursing and industrial hygiene. So, we quickly crossed the lines of our business to figure out how could we help our clients through this, especially the clients that were essential services, providing essential services and were mandated to stay open, and they needed some guidance and help. So we spent probably at least the last 6 weeks or so, and we've been the last couple of weeks helping a lot of other businesses. But for the first few weeks, we were helping our clients who were in the essential services. So helping them with their protocols and the ability to stay open, keep people safe, keep their employees safe, customers, depending on what kind of business they're in. So the last couple of weeks, we've been doing some webinars because we thought, okay, now we've got lots of information to share. How can we take all of that data that's out there, which is a lot, and help clients navigate this in a way that might be more meaningful to them instead of getting bogged down in all the things out there. So we put together this little webinar. It should take about half an hour or so to walk through, and then I'd like to have some time for you guys to ask specific questions, or if you want to reach out to me offline to have a chat, I'm more than happy to do that. So it's been a combined effort really of some of the lines with DMC, and we've been around for 18 years, don't always cross over like they have. So we've really blended the team right now, which has been a fascinating exercise for us to be able to have the lines crossed with the industrial hygiene and the occupational health and safety. So we have nurses involved and we have our safety people involved who are used to doing risk assessments. So, we're used to doing hazard risk assessments and putting those in documents for companies. Now we just needed to analyze a different risk, a risk that we've obviously no one has had before. So we just needed to break down to understand COVID-19, and then we could help our clients navigate that risk. So while we had a lot of experience doing risk assessments, obviously we didn't have any doing this particular risk, but over the last several weeks, we've gotten pretty involved. So what we know about COVID-19, so we know that it's a health hazard, the epidemiology of the disease. We know how it spreads. We know that there are several groups that are at high risk: the elderly, the immune compromised, or individuals with underlying chronic conditions. We also know that 80% of people have mild symptoms. But importantly, we also know that asymptomatic people can also transmit the disease. And that's really important in understanding how to mitigate a risk when you need to mitigate a risk that you can't see and that you don't even know if people have it, but they still could be transmitting it. We know that it's transmitted through droplets and contact, contaminated surfaces and objects. And we know that depending on what the object is or the surface is, that it can survive from hours to days. And it's early days, it's when people are transmitting it. So what we did was we took, the information and the science that's known today, and I always have the caveat that it's always changing, and there's always new information becoming known, so that, sometimes we need to adjust what we're doing. We took all of that, and then we're able to put in the best practices that we could find in order to keep our clients safe. So what we all need to do now is collectively think about our own workplaces. So think about, as I move through the rest of the presentation, think about it in the context of your own workplace. So, and while everybody got ideas out there of what they need to do, you just need to be mindful that they may not all apply to your workplace. And what some people need to do might be different than what you need to do. So, you know, don't go madly off in all directions, putting all these things in place. You need to remember that we might be in this for a really long time. And, you know, if you're spending money on things, you need to be mindful as to making sure that you're doing the right things, you know, to be as safe as you possibly can. So what are your responsibilities as an employer? So as an employer, you always have an obligation to take every reasonable precaution to ensure the health and safety of your employees. So you already have an obligation to provide a safe workplace. Now we have this added complication of COVID-19 that we need to do our best from a best practice perspective to see what we can do. So what you need is a mitigation plan. And in order to do the mitigation plan, you need to know what risks are in your particular environment. So I'm going to walk through that. Then you need to be able to communicate that plan, or have an orientation for employees and a communication process for customers if you have customers. You need to monitor the new information and update it as you need to do. This, you know, we are all walking through this at this, you know, we're all learning as we're going. So it's important to make sure that you try to stay as current as you can with information, and then update the process as new information becomes available. And then you'll need to follow those protocols and process. So whatever you decide to put in place from a protocols and a process perspective, then you need to make sure that you have a way to maintain that. And then I'll talk briefly at the end about a response for a positive test. So, and that was the last thing we did with our clients, because we were so busy trying to get everybody up and running that, you know, it was towards, you know, the end of the process in working with them, that then we put protocols and processes in place for a positive test. So what does a safe workplace look like with COVID-19? So you need to do a hazard or risk assessment. You need to break down, it's individual to every workspace. So you can't take someone else's hazard assessment and apply it to your workplace. You might end up spending money, or you might end up that you don't need to spend, or you might end up missing risks that are particular to your workplace. So it's an individual assessment, which is why I said to you a few minutes ago, think about all of this in the context of your workplace. So you need to also look at your workplace through different lenses. So you as a company owner would have a lens, obviously, of what you can afford to do and what you need to do, and whether you can still make money with the processes that you need to put in place. And then you need to look at it from the lens of your employees. So, you know, how does the day look for your employees? So walk through your space and think about it as the employee will think about it. And then if you have customers come into your workplace, you need to walk through and think about it through the lens of your customers. So what are your customers seeing? What are they touching? How are they going to feel when they walk through? And then from a health perspective, what do you need to do, you know, and what do you need to do from a safety and risk perspective? So when we do these assessments for clients, the risk assessment, we actually have a safety engineer and an occupational health nurse. So we have, because those two lenses in and of themselves see totally different things. We do them in person and we're doing virtually. So it depends on whether or not we can be close to the company. If we can't be close, then we'll do it virtually. And then you need to pay attention to what Health Canada is saying. So there's lots, because Health Canada actually has some protocols depending on the type of business that you're currently operating in, and they might have good guidance for you or some tips that might apply to what you're doing. So then you compile a list. So once you've gone through and you've looked at it through the various lenses, then you should be left with a big list of what those risks are. You know, like I said, as it relates to the owner, the employee, and as it relates to the customer and what that looks like. So then you're going to think about what are we going to do with all those risks? So then you need to assess each risk or hazard and relate them to what do we know about COVID-19. So you're going to think about your staff, and I'm not going to go through every possible risk, but I'm going to just talk through a few with you. You're going to think about your staff, and you're going to think about how do your staff interact with each other. You're also going to think about the demographic of your staff. Do your staff have underlying health conditions? Do they interact with customers who may have underlying health conditions? So, you just need to think in broad terms about the demographic of your staff, as well as who your staff interacts with. This is a critical process to go through because this will impact the mental health of your staff. Right now, everybody is feeling anxious. People are nervous, and going through this systematic process will make everybody feel a little bit safer, and also give your employees the comfort that you've gone through and you've taken the time to go through this kind of a process. And going through this process is mandatory in a lot of provinces. Not every province is asking for your mitigation plan to be submitted. Some provinces are, but they are asking that you have a plan in place. So your employees may ask to see the plan that you have in place, or somebody from WorkSafe may ask to see the plan that you've developed. Then you're going to think about common areas. Where typically do employees gather or customers gather? Are there common places? You may need to rope them off, remove them, or have them locked so that people can't access those common areas. Or how can they do it safely? Can people keep the 6-foot distance if they're going to access those common areas? How do people enter the building? So is there one point of entry, several? Do everybody have to open the door handle? Is there automatic open? How are you going to make that look safe for people to actually enter in? Is it a door that you could just prop it open and leave it open? Or you wouldn't be able to do that because of weather. So you need to think through all of those things about the entrance. Physical distance. Physical distancing obviously is the #1 recommendation if people can keep 6 feet apart. So is that possible? Do you need to move furniture? Do you need to reorganize how people will be? Are they all in offices so it doesn't matter? So you need to think that through, what is logical, and if you have customers coming in, how are they going to maintain the 6-foot distance? Do you have contractors enter your workspace, or delivery drivers, or people making deliveries? And how are you going to make that safe for them to be there? Or do you need them there, or can you have an alternative? The quality of the work. Are you going to be able to maintain the quality of your work while you're putting all these processes in place? Can you change something or do something, have people do something from another location, or, so just thinking through the quality of your work. Customers and interaction. So do customers interact with your employees? How does that happen? How can you change that? How can you make it safer? Some people are putting up plexiglass, so how does it look between customers and your staff? Smoking is another thing. If you have a smoking area or off-site smoking area, a lot of our clients have just shut those down altogether because it couldn't be guaranteed that people could maintain physical distancing in their smoke sheds or shacks or fenced-in areas, or whatever the case might be. So it's just something that you need to think about. High touch surfaces such as doorknobs, light switches, so who's responsible for that? Who turns on lights? Are you able to leave doors open so that people have less doors to actually touch? Because if you do have a lot of high touch surfaces, then you're going to have protocols for cleaning that. So, how can you avoid having to clean stuff, clean all those things if you can leave them open, or, have a protocol put in place for who's responsible for doing those things so that everybody's not doing it. And then everybody is getting exposed. Shared surfaces, microwaves, break rooms, keyboards, fridges. I mean, a lot of our clients have just closed the fridges and said in the office and said that people need to look after their own food. Drinking fountains are closed. These kinds of things that are difficult to maintain and are high risk, then, how can we just avoid using them? Having a process for mail. So if, depending on what happens to your mail, do you pick it up in a box or, at the mail? Do you get it dropped off at your office? And if you do get it dropped off at the office, what are you going to do about that? I don't know if anybody saw the national news last night, but they did talk about that Canada Post has had many positive cases in Newfoundland and Labrador. Canada Post actually shut down for a while because we had some positive cases. So what are you doing with mail, and what kind of protocol? And we've spent quite a bit of time in the last few weeks putting protocols in place for the mail, and who's going to touch it and how long you're going to leave it, and those kinds of things. Whether or not there's elevators in your building, and if they're shared elevators, or if they're just for your employees, and who's going to be responsible for cleaning it. And if you're in a building that's owned by somebody else, what are their protocols and what kinds of processes are they putting in place? Also for using stairs, you know, how wide are the stairs? Can people safely pass on stairs, or are you going to have, you know, just one-way traffic on the stairs? Also money handling, if people are actually touching paper money or coins, what's the protocol for that? Or are you eliminating that and people have to pay by card? So those are just some of the things that you need to think about, and you need to take every single thing individually and then mitigate the risk for that particular hazard. So it's really important that you think those things through, whether you work indoors, whether you work outdoors, you know, shared workstations. The list goes on and on depending on the company. And I'm just really giving you a few just to kind of start your brain to think about, you know, what you need to look at when you're breaking down your business by the risk, to think through what kinds of things that you can put in place. So then the next step, so you've got your risks. The next step is to think about, you know, what are you going to consider for in order to mitigate those risks. So you may be thinking about pre-screening. So what does pre-screening look like? Are you going to have a daily questionnaire, a weekly questionnaire? Are you going to do temperature checks? If you're going to do temperature checks, can you access, you know, the infrared touchless thermometers? You know, are these things reasonable? Can you, you know, do you have customers and it's not going to be able, you have, you know, there's a lot of traffic and you're not going to be able to do that. So you need to kind of walk through that. And what, you know, you also need to think about, we're in this for a long time. So if you're going to implement some of these things, you know, taking it away will be hard. So is it something that you guys can live with for a long time, and are you able to do it? So, you know, you just think about what's logical, but then you also need to think about how close do your customers get with your employees. And you might need these things because it ensures health. So, you know, just walk through and talk yourself through those processes. Personal protective equipment. Are you going to require personal protective equipment? And if you are, then you need to be able to access that. How does that equipment look? You know, what are the requirements from a mask perspective, or, you know, gowns or gloves? And also, if you are going to require PPE, then you also need to make sure you have protocols so that people know how to don and doff the equipment, because you can get in just as much trouble, you know, putting it on and taking it off, you know, as to whether or not it's safe to wear it. So you just need to make sure that if you are indeed going to go down the road with personal protective equipment, that you take the extra steps to ensure that people understand how to safely store it, how to put it on, how to take it off, and all of that. Then there's the cleansers and sanitizers. You know, they have to have a certain percentage of alcohol, so you need to make sure that the DIN number is okay with Health Canada, so that you know, you are purchasing cleansers and sanitizers that actually kill the virus. So making sure they're approved by Health Canada is important. And then where are you going to locate these? You know, if it's hand sanitizing, you know, where are the logical, obvious places that these should be? And sometimes you might forget that it needs to be in a certain place. So just, you know, taking the time to make sure of the location of those is critical. Cleaning and disinfecting. So what they're recommending is that you need to clean more often than your regular cleaning. So you know, how does that look for you? Do you have a contractor who does the cleaning? Do you do it yourself? Are you going to meet with the contractor, make sure that the products they're using actually kill COVID? And if you're doing it yourself, how does that look now that you're going to be, you know, increasing the frequency of cleaning and rigorous cleaning? So, you know, and do you need to add more things to the list of things you used to clean? Just to, you know, you might need to meet and have a discussion about that if you're using a contractor to do that, or if, you know, if you're doing it yourself or privately. Hand washing stations. Hand washing is pretty critical, access to warm water and soap. So, you know, is there availability of hand washing stations with lots of paper towels, so that the paper towel can be thrown out, and are the garbage containers lined so that nobody actually touches anything? Just, you know, just thinking through the hand washing. Physical distancing, is that going to be possible? And I know I talked about that on the previous slide. Is it going to be possible to distance physically? And do you need to, you know, rearrange your work site or the workstation, or, you know, how can that look? How does the physical distancing look in your company with the number of people you have? So there's a lot of factors that you might have to take into consideration. Engineering out the hazard, so isolating people from the hazard. Plexiglass, you see in the grocery stores now, there's plexiglass between you and the clerk who's working there. And is that possible? We have clients who actually have put plexiglass in place in fish processing facilities, and the plexiglass is on wheels so that we can move it around to workstations. So is that something that would be most logical depending on your type of work environment? I can't stress enough how important signage is, and I'm sure we can all relate to this now. When we go to the grocery store or the drugstore, we're immediately looking for signs now. I want to know where I got to stand. I know which direction the aisle is sending me, and where, you know, I don't think you can do overkill on signs. Signs. Everybody wants to know where they have to be safe, and that comfort and that trust in knowing that you've thought it through ahead of time, and here's the sign, because now we know you're looking for what you need to do. So having a sign is really important. Nobody ever liked before being told what to do, and now we all want to be told what to do. So, you know, signs, and just reminders. Signs, again, reminding you how long to wash your hands in the bathroom, how to safely, or how to, you know, the right etiquette for coughing, the right etiquette for, you know, what you should be doing if you sneeze. And constant reminders are really important. Obviously, you don't want to, you know, have overkill with signs everywhere, but I think strategically and thoughtfully placing some signs around are valuable right now. I know I'm looking for signs of where I got to stand in a store. So I think there's a lot of comfort and trust that your customers will have in knowing you've thought that through and you've measured it, or whatever the case might be. So I think signage is really important. The number of people that you're going to have. So you may decide that, you know, just because we need to physical distance, that's the best option for us, but we can't have everybody here at the same time. So we're going to reduce the numbers or the number of customers. All those things need to be taken into consideration. So, you know, you might need to reduce that. You might need to stagger arrival times, because if a lot of people arrive at the exact same time, that might cause some congestion at the entrance or in common areas. So you might want to stagger your arrival times. The logistics of the lunchroom, you know, what we've done for a lot of our clients, especially, you know, that have a lot of employees, is we've just removed the furniture from the lunchroom, and we put an X on the table, and the chair is by that X, and that's where you're going to sit to have your lunch, and it's 6 feet from the next person who's having their lunch, and there's another X on the table. So you might need to logistically remove things so that there's no opportunity to present a risk, because you've removed it. So so logistically, you might need to do some things within, or if there's common benches that people sit on, then, you know, they're just taped off and they're not used. And the same with small meeting rooms. You know, just take them out of use. Some companies are using the foggers for disinfectant, so you might, depending on what type of work you do, those might be a logical option for you as well. Okay, so those are just some of the things that you might consider. And then, so once you've done that, you now have your plan. So you've gone through your risks, and then you've gone through your risks, and you've gone through your mitigation, how you're going to mitigate each one of those risks. So that's your program, right? So now you should have your operational plan now after you've gone through those steps. The next step is pretty critical. This is your communication plan. And this eases the anxiety of your employees and your customers. There's so many rumors out there. There's a ton of misinformation. So your communication plan is critical. So, you know, it's pointless to go through the first few steps if you don't have a plan to how you're going to communicate this. And you may, depending on what province you live in, you may have to submit this plan. I know in New Brunswick, you don't necessarily have to submit it, but they may ask to see it. So, so you're going to have your plan in place. And you need to think about, first of all, your staff. So you know your staff best. How best should you communicate this to them? Is it by a Zoom call? Is it that you meet people in person? Some of our clients actually had us do the orientations with staff in the lunchroom. Everybody was physical distancing, and because of the nature of their employees, they thought they needed to be able to interact in person and ask questions if they had any anxieties. So, so you need to think through how you're going to do that. You need to be mindful that everybody is going through the pandemic differently. This could be triggering other people's past experiences. It could be, could be triggering some traumatic event for people. People are going through this differently. They could be worried about their parents or their grandparents or their children. They're trying to work. So, there's a lot of stress on people right now. So, how you communicate this, if you want your employees to come back and feel safe, how you communicate this will determine the success of how it goes. So, you need to be extremely empathetic and understanding of people's concerns right now. You might not have those same concerns, but you need to be empathetic to your staff. So this will have a big impact on people's mental health. Also, how are you going to communicate it to your customers? Are you going to do it on your website? Are you going to do it, have signs in the windows? How are your customers going to know if and when they show up, if you do have customers that come to your site, that you've put a program in place, you've thought it through, and that they will be safe? Because it's not going to take much to end the trust. So, going through this process early will determine how successful you will be. Communicating with contractors or deliveries. So if you do have contractors on site or you have people making deliveries, how are you going to communicate your plan to them before they come? So there's no mystery and there's no panic, because everybody's going to be watching how you interact with people who come on site. And how are you going to do that initial orientation with your staff to make sure that they have an understanding of what the protocols are going to be? The communication should be two-way. So if they bring up concerns, and they should have an opportunity to present those concerns to you. And you can even involve your employees in the risk assessment, because they could see things that you don't see, or have an understanding of a process that you might not be intimately involved with. So I think that two-way communication can really help in the long run. And of course, a high degree of common sense. So, which is why I'm encouraging people not to go off buying a ton of personal protective equipment because they think that's what they need to do, because they may not need to do that. So, go through those steps early so that you can make the determination as to what you're going to need. And you also need to be mindful that this is evolving. So, regulations may change. So you're putting things in place that you might not need forever, you might need for a long time, but there will be some changes as we progress. So just be mindful that you need to do that. Also, don't forget that workers have a right to refuse unsafe work, and right now we're seeing that happen. We've seen it happen a lot with the companies in the early days of putting these protocols in place, simply because in some cases it was misinformation and people are scared, and we all understand that. Nobody took it personal. People have a right to refuse work if they feel they're unsafe, and then we would bring in occupational health and safety to determine if there was other things that we needed to do, or they would advise the worker that it was safe and that the company had put the necessary protocols in place that were required at the time. Always keeping in mind, of course, that we're learning new things and then we're adjusting as we go. I would recommend, though, that you not relax any of the things that you put in place unless you first communicate that. So, if things do change and you decide that you want to relax a certain protocol or process that you've put in place, I would recommend that you communicate that and give people a time to adjust, or also give people time to ask you why you're relaxing any of the things that you've put in place. I'd also recommend you have a discipline process, so that discipline and a protocol, I guess, for discipline for employees and a process for customers who don't follow the rules, and I would act swiftly with regards to that, so that people know upfront that these rules and protocols are now company policy, and breaking these rules is just like breaking any other policy. I don't know what kind of disciplinary process you have in place, but I can assure you people will be watching how you handle people not following the protocols. So, and the same goes for customers. We have had instances in the last few weeks where employees didn't follow rules and they were asked to leave or suspended. So it really depends on what your protocols are, or how far somebody takes it, or what kind of business you're in and how critical it is. I mean, most companies have instituted a zero tolerance, but that's entirely your call based on disciplinary protocols that you currently have in place. And the same goes for customers. What are you going to do if a customer's not following? So think it through ahead of time and don't be in a panic as to when it happens. so that, you know, you're trying to figure out, oh, who's going to tell that customer or who's going to talk to the customer. Have a protocol in place, and don't delay, act swiftly. So next is updates. So, and I know that I've stated that this is an evolving process. So, you know, keep things as current as you can. So stay up to date as much as you can with what is happening, especially for your industry or your particular business. So provide regular updates, you know, if you need to, with regards to new best practices from an implementation perspective. And as I stated, I wouldn't relax any of the processes without first communicating them. And that goes for your employees and your customers as well. So, just a final note on all of that is following the protocols and processes. So everyone must follow. So business owner, CEO, directors, managers, everybody has to follow the process. No exceptions. Everyone's going to be watching. Customers are going to be watching. And, you know, I'm watching. When I'm at a store, at a grocery store now, I'm watching how the employees are interacting with each other. So, you know, people are paying attention to that now. It's quite fascinating because it's only been 2 months. And how quickly our brains have adjusted to not want anyone close to us. So, you know, and we're all feeling that. So, so everybody got to follow. If you've got your protocols in place, everybody has to follow the rules. Recommunicate again as changes occur. Know when to encourage or have your employees call 811. Don't take for granted that people understand all these new terms, you know, social distancing and self-isolating and quarantining, and, you know, people, as it relates to COVID-19. I mean, people need to, you know, so I would recommend in your mitigation program that you add a few definitions. They're easy to find on Health Canada website or lots of places right now, but just how do these terms relate to you and your business, and when you tell people to self-isolate, and, you know, what do all of that mean? Also include that workers have responsibilities that they have to follow again, and I talked about the discipline. So, you know, this is only going to work if your employees are cooperating, you know, because you can put all these protocols in place, and if no one's going to follow it and they're not taking it as serious as it needs to be taken, then, you know, other employees will quickly lose trust, or customers will. So there's a responsibility. And also, if you are going to have personal protective equipment required in your workplace, then you do need to have protocols for donning and doffing the equipment. Any questions? Well, we'll get to the questions shortly. Okay, just the last couple of things is a response plan. So I think the best way to go through this, having spent the last 8 weeks helping companies put their processes in place, is I think you should all just assume you're going to have a positive case at your workplace. And if you do that, then you'll write your response plan well. So, so have a response plan for if indeed someone does test positive, or we've had lots of cases where the employee's relative or someone that they were close to or that they've been close to in the last couple of weeks has been called to do testing because of contact tracing and these kinds of things. So having a response plan ahead of time is really valuable. And then communicate the plan to your employees and customers. Contact tracing, so, you know, making sure that you think about your customers, and I don't know what kind of businesses obviously you all have, but is it possible to write down, you know, depending on the type of business you have, you know, are you keeping a log of what days employees were in, or where their workstation is, or how many people they met with and who they met with, if it's possible. Obviously, you know, if you have grocery store and these kinds of things with higher traffic, it might be more challenging, but it is a good idea to think that through. Follow public health instructions. So when or if you do have a positive case or someone close to someone, you just call public health. They provide you the instructions. So they will tell you if you need to shut down. They will tell you if you need to do a deep clean. So they will manage that for you. And please be mindful of that this is still an illness, and you need to protect people's personal information. So, you know, while I know we're all talking about it, and I mean, obviously contact tracing is being done, so people are aware of who it is, but, you know, just show some sensitivity around the fact that if one of your employees does test positive for COVID-19, that, you know, they're having a really difficult time too, because they're probably thinking about personally who they've been in touch with. So, you know, be mindful that it is a sensitive thing. It's still an illness. And what I would suggest ahead of time is that you assign a response team. So if you assign a response team, and you might be the whole team, depending on the size of your business, but if you think through what you need to have from a response perspective, you know, that you need to have a team lead. You should have someone who is going to talk to the people who are doing the contact tracing or tracking. And if you do have information that, you know, that you have someone who's willing and able to share that. You might have to be in touch with the local agency. So depending on what kind of business you're in, food inspection and these kinds of things, you might actually have to reach out to them to let them know. So who's going to be responsible for taking that on, and who has the number ahead of time of who they have to call if they do have a positive case or someone is being sent for testing. Who's going to talk to public health? So who in your organization has that contact information and is going to make that call, and then you know, be able to be the liaison back and forth, providing information and taking information from public health to implement it in your workplace. Who is going to talk to the affected person? And you might want to pre-prepare some questions so that you don't have to call them back 10 times, because, you know, they're going through a lot too. So who is going to be the person in your organization that reaches out to that affected person to have a conversation, and who is going to talk to other staff about what's happening, because there could be a lot of anxiety or a lot of fear. So who's going to assume that role to communicate, and what's the messaging? What is the messaging going to be? And that will be dependent, of course, on the things that public health have advised. How are you going to communicate it to the customers or the public, or, you know, and whether or not you need to shut down, and are you going to tell them why? And then the sanitation and maintenance, you know, having somebody already having a number in your Rolodex for who you're going to call, depending on your organization. If it's required that you do need to do a deep clean, then you need to not be scrambling in order to do that. And the reason it's good to think about it ahead of time, and assuming that you're going to have a positive case, is this calms the waters so much better than scrambling and running around trying and panicking. Nobody wants to see anybody panicking during this. So, I mean, and I'm not saying that we're going to eliminate panic, but if you can plan as much as you can, then, you know, that can be pretty critical in your business being able to show responsibility in making sure that they do all the things right. You know, if you have access to your floor plans or where employees sit, you know, those things will be valuable for contact tracing. So, you know, I would suggest assume you will have one, and plan for it accordingly. If you never need it, that's fine. But if you do, you'll be glad that you went through that process. So that's the presentation. I'm happy to try to answer a few questions, not necessarily saying I got all the answers, but, you know, we've been doing it for 8 weeks, so I guess we're as qualified if there's anyone else right now.
That was excellent. I'm going to jump in and moderate some of the questions that are in the group chat. And maybe if people have a question, they can post it there. First question is, how much can we expect to pay for a touchless wand thermometer?
I don't know, $100.
Okay.
Now, I don't know, everything is up in price now. I'm paying $6 for N95s or $7, and I used to pay $1.65. So, you know, I do think there's differences in pricing. I mean, I think you should be cautious. We have clients who bought these $15,000 infrared thermometer things, and, you know, we're working fine with the $100 thermometers for some of our clients. Some of our clients couldn't find them, and they're using the ones that, you know, have the little air ones with the disposable plastic. But, you know, you also need to be careful about touching those things. But we do have clients that are using those as well. So, but that's the average price. I think $100. 80 probably. It's probably 100 now.
One of the things that we've heard and we've seen our Dr. Jennifer Russell explain to us how to take off and put on the cloth masks, and that they are single use and then need to be washed immediately after. In our office, we've ordered some disposable masks, but we've also ordered cloth masks for all of our team to have in case they're required for meetings, that sort of thing. My question is, we were told, or it was suggested to us by a pharmacist, that for the cloth masks, there might be times when we would use it just for a very short interaction. So the public health has suggested then that needs to be washed. Our pharmacist told us that if we misted them with an alcohol product, then we could reuse them at least for a couple of meetings of that nature, like short, brief interactions. What's your opinion on that?
Well, that's a tough call. So we don't have any of our clients using cloth masks. So they're using the non-surgical masks. And they're putting them in Ziploc bags in between use for the most part. I'm really not familiar with the spray. I could ask. I haven't experienced it where people are spraying cloth masks for use without washing. I would have to ask what our occupational health nurse would know about that. I can definitely provide you an answer. I will ask her what her opinion. I don't know if she's experienced it.
My question then would be for the non-surgical masks, are you recommending that people dispose of them immediately after each use, or you're okay with people ziplocking them and reusing them?
We're using them for up to, I think some of them we're using them for up to 8 hours. So then if you're only using them for an hour in a day, then we're reusing them for up to 8 hours of use. But we're putting them in Ziploc bags and your name is written on the bag.
That's good.
But different people are doing different things, right? I mean, right now that could change tomorrow and there could be new evidence to say we shouldn't be doing that. So everything has the caveat that we're still learning. Okay.
Do we have other questions? I don't see anything typed into the group chat, but we'd love to, this is your opportunity to ask an expert on some things that you can do in your workplace, or the types of things that you might want to include in your plan. I will say, Dallas, that the Chamber has, as every business in New Brunswick has to do, we have to have an operational plan. The Chamber has done our plan and we've posted our plan on our website. So if anybody wanted to have a look, just to have some guidance there. We also did a reopening and recovery of New Brunswick guide for businesses, which covers a lot of similar information to what you've talked about today. But those are both available on the Chamber's website. Now, a question did just come in. Are there guidelines for the size requirements for plexiglass barrier?
Well, the guidelines are just really around how it's the 6 foot. So if you're going to have plexiglass, the person behind has to still, if there's openings on each side, does that still maintain the 6 feet? So it's really around, if you only make it this big, well, then there's still access around. So it just goes back to the 6 foot distancing. So the plexiglass needs to be as big as you need it in order for the person to not be physically connected to the person by 6 feet. So I don't know if that makes sense or not, but when you're going down the aisle at the grocery store, and I've calculated, just where she is behind the plexiglass and where I am, we are further than 6 feet apart. The only time I'm within that 6 feet is when the plexiglass is there.
Okay. And I've reached out to the ONB navigators and asked similar questions, Dallas, and what they've said is that it's the business responsibility to ensure that physical distancing is maintained. And if you're not able to maintain physical distancing, then you need what they call engineered distancing, which is to put up those barriers. Yep. So
and that's what I talked about. You engineer out the hazard, right? So when you engineer out a hazard, you're putting something physical in place. Yeah. It's so isolation.
It's up to the business to interpret exactly how that looks for them in the individual circumstances. What they're telling us here is that if you do get a visit from WorkSafe or from public health or from public safety, they will deal with it in what they're suggesting to us in a coaching way, so that if they feel that you may have missed the mark on something, they will coach you into how it would look better for you, but that they're not able to visit all businesses in the province at this time. Now, we've got a couple of other questions that have come in. What about office Keurig machines? Can we use them?
We're recommending no.
So you might want to bring your coffee from home or stop at a local small business and pick up a coffee on your way into the office and support local.
Yeah, that's what we're recommending right now, just because who's going to be, unless you can maintain the cleanliness, like you know, every person got to clean it before or after, like it would just be a lot. So the easiest thing for us to do right now, I mean, who knows that may change, but currently with our clients, we've just, those kinds of things, we said, bring your own coffee.
Here's a great question. Are there guidelines or suggestions when over 3/4 of the staff are working from home? Does your response plan need to include a protocol for staff who are working from home?
Do you mean that you have to put in a protocol at their house?
I think that's what is being asked. Yes. Are you responsible for providing a protocol for an employee that's not working out of the office, an employee that's working remotely?
Well, I don't know if there's a requirement for that, but I mean, I think certainly it's good to share with them what best practices are. And it will probably be more about, you know, making sure that they're staying in their bubble. They're not you know, they're not around other people, because you want them to be able to continue to work. You know, I think it's nice to be able to communicate what, you know, when you are out in public and you do have to go out, you know, what are the safe best practices, but I haven't seen a requirement for that right now.
It might be something good to include in the operational plan, in that your employer recommends that you take
Yes.
the following precautions.
Yeah, I think that's good. I mean, you also need to be mindful that people working from home are still covered under WorkSafe. You know, keeping people safe while they're at home is important as well. And Krista, that is an area I feel like I'm an expert in, but today we're talking about COVID. But you know, I think you need to also be mindful that people could get injured at home,
Right.
and they're covered.
Another question that's just come in, asking about if you could use a face shield instead of a face mask.
One does not substitute for the other. We actually have some of our companies that we're working with where we have people wearing both, because the eye is an entry point and your mouth is an entry point. So if you just have on a shield, you've still got your face not covered. So so one that, based on our current, depending on the workplace, I mean, it truly depends on you know, I'd almost have to understand what the workplace is but I know one does not substitute for the other currently on any work sites we've been on.
Okay. And I guess it depends on the interaction that people have.
Yes, it does. Yeah. How close they are.
Yeah.
What the risks are.
Any other questions that people would like to ask? I guess one thing that that has come to my mind, Dallas, is from this conversation, I plan to reach out to our landlord and ask them what their protocols are with regards to the entrance of the building, the elevator, the stairs, the washrooms, and so on, because I think it's important for us to be able to share that information with both our employees and with our clients or anybody that might be coming into our space, which is very limited. But that was a great suggestion that I had not thought of.
Yeah, I did it yesterday from my office in Moncton, and I haven't reviewed it yet, but I did get a response from the building owner with their protocols. And he might realize that I'm going to have a whole team reviewing that to see what the protocols are before my employees in New Brunswick can safely go back to their office in Moncton. But I'll be taking a look at that today.
Yeah. Got another question here that just popped into the chat. If you're unable to maintain physical distancing requirements and you do decide to go with PPE, it says there's a requirement to keep a log of employees and visitors, but there's another indication elsewhere that says this does not include customers. What constitutes a visitor versus a customer?
Well, you know who's a visitor and who's a customer. I mean, a visitor could be the delivery person. You know, I think that if you don't have customers coming in to interface with you, you should just limit the amount of people who can be in your building at this point. I mean, I think you'd log anyone who comes in. I mean, deliveries are usually logged anyway because you probably sign something. But if you have a sign-in book, I mean, obviously, or if you have someone who's looking after that, I'm not sure I completely understand what you mean. So
I might mention that what we've decided to do, our policy in our office, is that we're keeping a log of everybody who's entering and exiting our office. But Wendy, who sits at our front desk, is keeping the log because we didn't want to pass pens back and forth and pass
Yep.
notes back and forth. So Wendy is writing down each person that comes in and the time. So
Yep.
when
And
it's
it's exactly what we're doing. I mean, we're limiting the people who can come in here, but also if you come in, we're going to take your temperature, and before you come, you're going to complete a questionnaire. Because we just restarted safety training this week because we were allowed to, but before they come, they have to complete a questionnaire, and upon arrival, they will have their temperature taken, and we have the person at the front desk logging who was here.
So for us, if it's someone like the mail delivery person, we're just simply writing down mail delivery person and the time. But also there are two types of questionnaires, I guess. There's active and passive, and we've chosen to go with passive because we really aren't planning to have a lot of traffic in and out. The passive has a sign on the door that says, have you traveled? Have you had any symptoms? Those sorts of things, as opposed to actively. But we are on the hunt for a thermometer. So I know that as the staff is now back in the office, we'll be doing temperature checks of the staff when they come in. Now, another questions come in. I run a yarn shop. Would I need to keep a log of everybody coming into the shop, including my customers? I don't have many visitors who aren't customers.
Well, I think that, I'm not being logged when I go to the grocery store. So I think you need to do what's logical. If it's cumbersome and really hard to do that, that might be a challenge. But if it's not a big deal and you don't have a ton of customers, maybe it's something that you can do. I mean, it's just really about thinking forward from providing, to be able to trace who was around. Otherwise, you got to put out a public notice as to, did you visit this store? So, on this time. So I think that, if you can keep track of it and it's not onerous, I think it's a great idea to do that, just because contact tracing will be that much faster. And I know that the government is looking at all kinds of things for contact tracing, where we download an app on our phone, and if someone tests positive, they're going to be able to trace that you were near that person. There's all kinds of things being considered. But I think if, it's really just to help the process. I mean, that's what we're trying to do, be able to, notify people quickly if they need to be notified.
Right.
So it depends on what's cumbersome. I mean, if you have a lot of people coming in, it might be hard to do that. But so it's something that you'll need to, I guess, work out on your own individual, whether or not that makes sense for you.
So that, and one last question, what are the timeframes that are being recommended for contact tracing? Only others who were in the business or in the organization at the same time, or anybody who visited that day, or how is that working?
It'll really depend. It depends on what we're just taking our cue from public health. So it really depends, the contact tracing, when they commence it, and what they will provide the guidance for you as to, and they use some kind of algorithm that, because I've been surprised that I thought some people will be called and they weren't called, just because. So they're using their own protocols. I don't have them, but they will determine from a time frame. And in Newfoundland and Labrador, they went through that with the funeral home. All right, so there was 2 funerals in one funeral home, and 180 or 90 of the 260 odd cases that they had all came from that. So there was a lot of contact tracing that went on. So they got good practice in figuring out all the different connections, but there was a lot because everybody went home and everybody went to work, and a lot of people were asymptomatic. So it was, it was quite the process to have to go through that. So they make those calls from a time perspective, the time frame, and they even use, depending on when the person, how symptomatic, because the asymptomatic people are still contagious. So, depending how far along people were, they're even determining whether or not they would be able to participate in, and be called for testing.
Dallas, you made a comment about having a response plan for a positive test, and that you actually should write your plan as if it's the day that you found out somebody in your workplace has tested positive. And I think that's such a good idea. Early on, somebody put on Facebook, trace back who have you been in contact with in the last 2 weeks? Would you be proud of your activity, or would you be embarrassed? And it made me really think about, where have I been, like the post office or the grocery store or the pharmacy, and who have I had interaction with? And mine has been incredibly limited, but it really made me mindful of interactions that I've had, and it's made me be much more mindful of, even for myself, keeping track of where I've been and if I've been in a shop, and in my own mind, because, in the past we wouldn't think of that. We would go to the grocery store and stop at the bakery and go to the pharmacy and think nothing of it. But
and hug 5 people.
Oh, hug. Yeah, I'm a hugger. This is
Right.
killing me. I really appreciate, Dallas, your time with us today. It's 10:59. We've filled a full hour, and we really appreciate your expertise. You're always very generous to share information that's helpful to the business community and our members, and we appreciate that so much. We will be posting this on our social media and providing it back to you if you want to post it as well. And I thank everybody for attending today, and I wish everyone a great long weekend. Dallas, here in Fredericton, we're supposed to be going up to 19 degrees on Sunday, so everybody's looking forward.
Jealous.
Well, we had snow this week too, so who knows? But thanks very much, everybody, for participating, and wish you all a very good long weekend. Thanks, Dallas.